still breastfeeding past 8 weeks. So that is another data point, and we're trying to get additional localized information so we will know more. But only 61%, when we know that breastfeeding is both protective for the child and the mother, and is the best form of nutrition for the baby in the first few weeks, 6 months of life. So all of these data points to just continue to highlight the fact that we are not doing great in some of these areas, that we're doing worse than the state, or we're doing worse than national trends. And we have a variety of tools at our disposal to be able to address these things through either policy or regulatory interventions and programmatic and direct client services, let's say. We heard from my colleague that we have received over 1,400 responses to our public comment, either written comments, verbal comments at our public hearing, letters, phone calls, voicemails. We've allowed a variety of ways in which we can hear the community to give us feedback, which is exactly what we want to do. And we've seen some trends from these public comments. We've had overall very strong support for paid parental leave as a public health policy. A lot of community members really identifying that these types of policies can improve maternal health and recovery. They can support infant health and development, promotes breastfeeding and bonding, improves maternal mental health, and reduces stress, and they advance health equity and long-term community well-being. So there is a massive support from a lot of community members in these areas. We also have concerns around the funding model, and this is a most central point of disagreement. I think that an incredible amount of comments are stating that we believe that paid parental leave is a huge investment in our community. Let's just talk a little bit more about what this funding model looks like. So many support a paid in principle. We have some strong concerns around employer-only funding, and some suggestions on how we could do this, and this is the primary source of disagreement. We have some concerns for small businesses and nonprofits, and the costs that would be difficult to manage in these situations, especially with staffing shortages and operational disruptions, cash flow and thin margins. So we're hearing all of that. But on the other hand, we're also hearing some positive on the workforce recruitment, retention, and the ability to support families during this time, and encouraging families to remain in Allegheny County. There is support around the fact that people would remain in their jobs, and there will be long-term retention in those areas. And it is really viewed as an important piece for economic vitality in Allegheny County. We have heard hundreds of personal stories around just the high impact that not having paid parental leave, and the people that have commented and told us their stories of postpartum depression and anxiety, traumatic births and C-section recovery, financial hardship, breastfeeding challenges, missing early developmental milestones, stress from returning to work too soon. So very human stories that really underscore the importance of adequate leave. And then also on the other logistical side, the stories around inadequate leave that exists or are non-existent in different industries. And I think that the overall sentiment is that it calls for refinement of the policy, not necessarily rejection, and that most commenters want improvements to the proposal rather than opposing the comments. So We are taking all of that into consideration. We are very thankful for all of the suggestions, all of the ideas and ways in which we can make this particular regulation even stronger than the first time around. So we are taking all of that into consideration. So I just want to just highlight the fact that we are reading every single comment and we're looking at every single one of the suggestions and proposals. And this is not, they're not going into a black hole and never to be seen again. This is a very intentional process that myself and my team are putting forward. And the last piece, we are continuing to work on the community health assessment, one of the biggest projects that we have going on this year. So far, we have close to 1,400 responses to the survey. If you have not taken the survey, please do so. We have the QR code and the link linked to our website, to social media. We really want to hear the community's opinion on what do we need to work on in the next 5 years, what should be our priorities, what should be our goals, and community feedback and personal experience are really essential in making sure that healthy neighborhoods continue to thrive, that we are focusing on areas of need and concern, and there's also a chance of winning a $100 gift card through our raffle process. So you will continue to hear me continue to focus on the community health assessment moving forward. This will be open until the end of the year, and the goal for us is to reach 5,000 survey responses. And that concludes my presentation for today, and I'll be more than happy to take any questions from the board at this time.
Well, thank you very much, Dr. Mann, for that wide-ranging but very informative director's report, and for the updates on recent outbreaks, and for your intentional and transparent approach to the paid parental leave process as it moves forward, as well as the reminder about the community health assessment. I did have a question about that. Is there an age requirement for the community?
Yes, 18 or older, and you must live in Allegheny County.
Okay.
Thank you for that.
All right, thank you. Does anyone else on the board have questions for Dr. Mann? Okay.
Great.
All right.
Thank you.
Wow, thank you very much. And I think our next presentation, technically still part of the director's report, but I think we will hear from Dr. Jim Whedon. It's about a couple of matters, I think. Oh, okay, about opioid overdose prevention and prevention. Thank you.
Hello, I'm Dr. Jim Whedon. I am the new Deputy Director of our Health Promotion and Disease Prevention Bureau. I've been in this role for about 3 months now. So,
Congratulations.
Yeah, prior to this, I was with the Health Department with our Chronic Disease Violence and Injury Prevention Program. So I'm going to talk about our opioid overdose and prevention program. The next couple slides, we'll see we have it broken down to overdose death trends, the drug supply trend that we're noticing, and then also our program response plan to what we're noticing here. So these are overdose deaths that we're seeing. You can see that we're still seeing a decrease in the trends of overdose deaths. By year, my eyes are getting a little bit older, so I can't quite see how much they've gone down, but they are continuing to drop down. But you can see they are starting to level off a little bit. Our next slide talks about overdose deaths rate by race. While we're noticing a decrease in Black overdose death rates, there still is a pretty large disparity between Black and white population of overdose deaths. This trend, as I'm sure you can see there, has significantly dropped off. It's also kind of starting to level up a little bit here from previous year for 2024 to 2025. And you notice that the white trend has also decreased significantly. Well, it's starting to level off as well. So this is our overdose death by race and age. This is where you can see our biggest disparities, particularly among Black older males in Allegheny County, ages 55 to 64. We see quite a large difference between those two there. I'm going to pull this up on my phone so I can see it a little bit better. And then you also see the difference between ages 65 to 74 for the overdose just trends age by race. So overall, we're still seeing a pretty large decrease in overdose death trends here in Allegheny County. We think that could be due to a couple factors here. One is our response rates that we're seeing through the opioid settlement funds and some of the other work that our program's doing. But also we're noticing a trend in the drug supply is changing. Thanks. And the trends of the drug supply here is we're noticing that multiple alterants and contaminants found in the fentanyl, as well as also we're noticing a large difference in percentage to see a pretty significant increase in methamphetamine in the drug supply. Methamphetamine is similar to xylazine. It is a tranquilizer, veterinarian sedative like xylazine. We're noticing that hospitals are facing an increase in withdrawal. The issue with what is happening with methamphetamine is that you are less likely to experience an overdose death from methamphetamine. However, there are significant withdrawal symptoms from methamphetamine, and without getting the severe withdrawal, if it's not treated, can result in death. We're also seeing that severe cases can also result in a multi-day stay in the intensive care unit in hospitals in Allegheny County. So this is a drug substance testing that we've seen here. Notice that the xylazine, we're starting to see a drop off in what's showing up in the drug supply compared to methamphetamine and the local anesthetics like lidocaine. We're starting to see deep increase in those in the drug supply. So this is the methamphetamine trends that we're noticing from drugs that we're seizing here in Allegheny County. You're seeing that there was a pretty significant increase around the 2025 in December, but it has since kind of dropped off a little bit. It's kind of starting to level off, but we're still seeing that this methamphetamine is really has a high, is really highly found in our drugs. So this is a slide I would like to call attention to is the emergency department withdrawal visits. We've talked to ED and hospitals, and they're not saying that they feel like they're overwhelmed. However, we are seeing this large increase in emergency department withdrawal visits related to methamphetamine. It's a 132% increase in the ED visits here with methamphetamine. And like I said, the hospitals that we've been talking to, they're not saying that they're feeling like they're overwhelmed, but we are still continuing to see this large increase that's continuing, and we expect it to continue to rise. So next is our overdose response and drug plan. As we continue to see this, we're making some changes in what we're planning to do here at the health department. We're creating and working on a rapid response plan to address this and other future drugs as we start to see the drug supply change. The biggest thing for us right now is doing education, particularly to physicians and community members, and also people who use drugs as well. So we are working to do monitoring and identification of the drugs, and this is through drug supply monitoring, looking at overdose spike detection tools, some genomic surveillance, and also through community-based reporting and working through our partners to recognize these. We're also looking to issue, and when applicable, a response to notifying partner agencies as well, coordinate that countywide mobilization to briefings and distribute opioid overdose reversal medications for overdose trends that we may see, and ongoing monitoring and coordination through response. So our response to the responding drug supply change, with the growing presence of methamphetamine, best practice for this is to distribute and utilize methamphetamine testing strips. We have received these through the CDC and are distributing these to community members and partners throughout Allegheny County. Also how to respond to this, so providing education to various physicians and hospitals as well. One of our plans is to potentially conduct a knowledge-based survey to physicians in Allegheny County to understand what their knowledge level is on how to adjust methamphetamine and how to best combat any withdrawal symptoms that they're noticing. And then the naloxone formulations and capacity overdose response, training and providing education on how to best go about those things. We also created, on the picture here to the right, you'll see the methamphetamine. This is a palm card that we are distributing out to community members and people who use substances in Allegheny County to encourage people that if they're starting to notice or feel these withdrawal symptoms that they should go to the emergency room or the ED along these, and also distribute these also in organizations across Allegheny County. So this is what we have been doing around our naloxone fulfillment and order and preventing overdose prevention. We have our vending machines. We have one outdoor vending machine in Allegheny County right now. We have 12 newspaper style stands and 10 wall mounted cabinets in Allegheny County right now. We're currently looking to continue to expand this to other areas and where the data best shows of where we could have these strategically throughout Allegheny County based on where we're seeing overdose deaths in Allegheny County. Our outreach and engagement. So these are through some of our partner organizations that we have here. Continue to connect with communities and resources on treatment, looking at housing locations, libraries, county jail and senior high rises. We also have advertisement on local radio and social media to boost participation. And as I mentioned earlier, the data-driven approach to mobile outreach and having those in strategic areas throughout Allegheny County where we're seeing rates of overdose deaths. Next is our social media marketing campaign. This is a campaign that we're releasing in Allegheny County. This is our third wave of doing this campaign. It probably looks familiar to some of us. Targeting messaging to approach and reach particularly Black residents 45 and up. Some challenges that we're having is just some language that we're being kind of directed to use from the CDC that we've had to make some changes to, particularly never use alone. We've had to change the language around a little bit to, have like something that's more harm reduction around having supplies such as naloxone and things around with them. We're also sending media traffic campaign to websites with more information and to seek resources where available. We recently launched a youth campaign around overdose prevention program for high school students in Allegheny County in 2026. This is a newer program. We're working on getting some feedback from the students on this program and how it's working right now from administrators throughout Allegheny County, particularly in Pittsburgh Public Schools. We're getting some positive feedback from staff from that, but we're also going to try to do some evaluation with the students to see what their thoughts are on the program. We would like to expand this program to middle schools as well from 2026 to 2027. We're also looking to partner and continue to partner through Allegheny Intermediate Unit using our school-based social emotional supports. This is our STEEPS program in 4 school districts in Allegheny County, December 2027. This is McKeesport, Steel Valley, Kent Hills, and Cornell. Also continue to fund and provide harm reduction and linkage to care and healthcare services to our partners in Allegheny County. Through Prevention Point, who you'll hear from here in a little bit after I'm finished, and some of our other organizations as well. And then we're also partnering with the DHS, Department of Human Services, to implement the Matters program, medication for addiction treatment and electronic referrals. This program is specifically meant to increase linkage and retention for addiction and treatment for Hep C as well. And thank you, that's all I have. Questions?
Thank you, Dr. Weiner, for this report and for the updated information on our efforts and the opioid epidemic. It's encouraging to see some progress being made. I do have a question before throwing it open to the whole board. With regard to the disaggregated data, looking at race and age, have you been following that over time? I'm interested to know whether the reductions in especially the Black population overdose information is coming from a specific age group, because on the next slide, look at the current numbers show that 45 and over age group, as you said, but has that always been the case, and has that always been where we've been targeting?
So I know for a time there, we were seeing a really high number in overdose deaths among Black older men. That has decreased some, I believe. We still are seeing a pretty large disparity. It was a big disparity before, so I think that's where we're starting to see some of that decrease, but we still have a pretty large disparity there, as you can tell.
Okay, thank you. Board members. Dr. Jonas.
Okay, thank you, Dr. Porlock. Same comments and questions really appreciated. I'm wondering along the same lines of the race, the limiting and sort of reducing of the race disparities, wondering big 2024, is there any new partnership, any new outreach? And you've provided some great information on the outreach strategies and accessibility. Wondering if any of those launched in 2024 or new community collaborations, because there's a significant drop and leveling, and that's just interested if anything comes to mind.
Yeah, I mean, to be honest, I'm not sure if that's a question I could truly speak to. I can give you what I would think is, I think that we're seeing a little bit of a combination of the change in the drug supply, which is causing a decrease in overdose deaths, and also some of the work that we're doing out in the community as well.
Thanks.
Any other comments? Dr. Solomon.
Thank you, this is very informative. I'm just wondering how reliable are the data source for these graphs? I mean, I know you said from the hospital and community programs, but do you trust, these data?
Yeah, I mean, as far as I know, I mean, this is the data sources that we've used prior to me even coming into this position, so we haven't changed any data sources.
And I did not hear anything about schools. Do you gather data from the schools, especially high schools?
We use our HAT survey, Healthy Teens Assessment Survey, to collect that type of data, but I don't believe we have any data from the schools on overdose deaths.
So it's integrated with the community program?
Correct.
I see. Thank you.
Any other comments or questions? Dr. Levin-Pettigrew.
So the long-term treatment for individuals using this particular drug, is it methadone, what is it?
I'm not sure exactly what the medication is, but it is something that they provide in the hospital. It's not methadone, I don't believe. Methadone is more for the opioid withdrawal. This is more to prevent withdrawal symptoms that we're seeing that can cause like heart attacks and issues like that.
It is an addictive problem, so it's something that is long-term, so you expect it to be competitive. So what, we're talking, so it's all around prevention, saving lives,
Yeah.
and acute intervention, and then what happens after this? Because it has to be somewhere in order to, it's probably politics, because there's probably many more drugs involved or other things. But what is the long-term referral plan? Are we working with places like Freedom of Shoes and other places that really make sure that kids or adults are getting the treatment they need to not do that?
Yeah, I think that's where our Matters program can come in, where we're trying to create linkage and then to refer people to, mental health services or things. And we're also seeing that there's an increase in mental health services in our early data from our community health assessment survey that we're getting. I think that's something that we're working on to build out and through partnership with DHS to put out some type of linkage to some types of substance use, treatment beyond that. As far as the methamphetamine, these people who are coming in, who are using this with withdrawal symptoms, right? And I think at that point, they're going into the ICU and critical care, so their goal is to treat that particular issue right there. And then, what happens from there is kind of on them. Unfortunately, that's kind of how the system is set up, so I think that's an opportunity for us to create some type of community clinical linkages with hospitals and systems, and then, do something to refer them to other healthcare services that can help them.
We're looking at some of the other variables that place it, that really explain the difference in the disparity between black and white, related to lack of employment, health, or wealth, or related to why there's such a higher rate with African Americans versus whites. And we can't roll the ocean, but to really have that data to see why they're using, the use is increased, which means that the overdoses are increasing. So I don't know whether we're tying with that stuff with the data that we're collecting. Are we looking at housing? Are we looking at income? Are we looking at those individuals who end up in overdose?
I think we were briefed on this before in years past, as the numbers had started
Right.
to come down, that was being looked at, but I think there's also an interesting point in the graph, 2 slides before this, where the racial statistics start to diverge, the one right after that, actually, sorry, right there, because it was affecting black and white populations similarly for the first few years of the epidemic. And then I think the answer started to be more about supply and where the drugs, how the drugs were getting into communities and who's being targeted by suppliers, but I'm not sure on that, and I'd be interested to know if there are other factors that created the disparity in the first place, because it didn't exist from go.
Right. I mean, first I would say and point out that the disparity has changed a lot, right? That doesn't mean that it's good enough for where it is. There's still a huge disparity. With that being said, our goal is to try to continue to get into those areas of where we know black and brown people are living, provide education, provide resources to help people to prevent overdose deaths. As far as what's happening to those people being targeted from the drug supply, it sounds like the question you're asking, that's not one I could probably answer, and that would be something I would have to refer to one of our partners to discuss.
Dr. Cuevas, I think, has a comment too.
Can I ask a question?
Yeah.
Are you able to track the number of people in Allegheny County who are engaged in therapy for opioid use disorder in terms of either medication or other recovery supports? And I'm wondering, because of the methamphetamine that's in the drug supply right now, and the difficulty in getting patients even on medications because of the withdrawal effect of that.
So the first part, I can't answer that question. I don't know. That's something that we can find out. Methamphetamine is creating a unique problem for us. We are working to have it identified through our more data. However, part of the issue is that methamphetamine also has a high half-life, or a very quick half-life, so it's leaving leaving the system very quickly. So it's really hard to test and identify who is going through withdrawal from that also. And people who are classifying the deaths from that may not be identified as someone who's using substances.
Okay, are there other comments, questions? Dr. Snyder?
I was reviewing your materials. It was very encouraging to see the very broad mix of vehicles, community locations where naloxone is being distributed. I can understand that some of that's beyond the health department's control, and that is in the hands of other folks. It's also very encouraging to hear that you're tailoring where unattended naloxone dispenser locations are, and you're tailoring media campaign, youth-oriented outreach to the need. So 2 questions for you. One is the mix of the community-based distribution of naloxone the mix that you want? Are we allocating resources where they're gonna be most impactful? And are we allocating naloxone as a resource in conjunction with other important resources, test strips, et cetera? Or is there insufficient overlap to make those kind of a synergistic?
Yeah, so to answer your second question, yes, we're not just providing naloxone, it's also providing testing strips for both methamphetamine and also for fentanyl testing strips. So yeah, to answer the first part of your question, I mean, I feel like we do a good job in getting out naloxone to the community. I always feel like you can get more out there, right? But with that being said, I'm pretty happy with what we're doing right now. I think that we can work to change as we're starting to notice drug supply changes, maybe getting out there a little bit quicker to the areas that we're seeing, maybe some data changes, like for instance, we're noticing that there's some maybe areas in Ross Township. So we're starting to try to develop a bigger presence there in certain parts there. But I'm pretty happy with how we're doing that right now.
Yeah, I think I was interested to hear about the geographic, seeing if there was any geographic targeting that could be done with the outreach materials as well, considering, wanting to be as strategic as possible, and also thinking about the youth outreach campaign. Not that it's not important, but it does seem like the younger age groups are most impacted at this point. So the targeting for the older ages seems like it's really, really critical.
Yeah, I think just to comment on that aspect, it's just us getting out in the community, particularly the school. This is a brand new program that we're starting to implement and developing some trust in there. Being in Pittsburgh Public School is a huge win for us. I think that will allow us to then quickly expand to other areas in Pittsburgh Public.
Okay, Dr. Young.
So just one really quick sort of reflection or comment, thinking just as we see federal funding cuts and different cuts in community health worker programs and other community engagement strategies, I know Aaron Arnold's gonna be talking next to, just thinking about like ways that this group and or building connections, sharing information, providing information and resources more publicly, just, let's lead into doing and learning and trying new strategies given the limited resources, because I think having those caring connections is what really helps people combine multiple needs in certain ways, and I'm just really concerned about the limitations of that as we see in the years coming forward. So thank you for the work and outreach, it's really encouraging, and just interested in learning on that and building on that more.
Yeah, that's definitely something that we've been working on doing. I recently made some changes to our program for opioid, and we're now combining it with some of our violence prevention work, which is a county-funded program, which allows us to hopefully do some cross-training between violence prevention and opioid overdose prevention as well. So do a little bit of both of that in the community. That's something that we just started maybe a month ago. We're really excited about. Also through some of our chronic disease injury prevention program through our Live Well, which is a public health campaign that we're really pushing some of this education and things that we're seeing out in the community. To saying, I totally hear your point in that, some funding has been cut almost everywhere. I feel like that we are doing very well with funding for opioid, and we're expecting another round of overdose to action funding in 2028. So.
All right, we have one more comment from Dr. Klebas, and then we are gonna kind of continue on this subject with the next presentations as well.
Sorry, another comment, sorry, it's my bread and butter. So I just wanted to appreciate your comment, Dr. Jonas, about bringing communities together, because I think it is not a big community that treats patients that have substance use disorder. So anything that you do to bring the various providers together, I think could be really helpful for the community at large. A lot of our people jump from place to place to place, and we're all taking care of the same population. So the more you bring this data to the people who are doing the work, I think the better for the community, especially data around methamphetamine, around overdose deaths, around the disparities. Thank you.
Yeah, thank you.
Thank you very much, and we will move on in our agenda. Again, staying on the same topic, to Mr. Aaron Arnold for a presentation on Prevention Point Pittsburgh and the Syringe Services Program update.
slides up. Thank you for the opportunity, and pardon my casual dress today. I remembered how stuffy it can get in this room sometimes, and I decided to play it safe and casual.
Stuffy or freezing?
Yeah. Prevention Blank Pittsburgh has been around for 31 years. We just celebrated that anniversary in May of this year. We began as an all-volunteer organization, as a syringe services program that was really launched in response to the HIV and AIDS crisis. We were so informal so as to not have sharps containers and to use wide-mouth pickle jars to collect used syringes. Today we are a nonprofit organization employing 16 individuals. We do everything from direct services to policy work, and we offer a continuum of services that is really unduplicated for people who use drugs in Western Pennsylvania. I'm going to start with our 2025 data. You should have received a copy of the annual report that we send in, so I'm going to cover just some of the highlights from there. We had a total of 1.4 million syringes distributed, and that was done across over 11,000 interactions with 5,000 unique individuals at our site locations. There were 3,000 individuals served by secondary distribution, which means that somebody else picked up supplies for another participant in the program or for another household member, maybe that hasn't made it to one of our site locations yet. 523 individuals interacted with the SSP for the first time. These numbers were pretty significant for us in that we have seen a sustained increase in the amount of syringes distributed since at least 2015, and possibly before that as well. So this was the first year we actually saw a decrease in the number of syringes distributed, and I'll get into maybe some of the reasons for that in a little bit. In our overdose prevention program, in calendar year 2025, we distributed just under 7,000 doses of naloxone to 2,000 individuals. 386 overdose reversals were recorded using that naloxone supply. We also distributed numerous test strips. For fentanyl test strips, it was about 5,500. For xylazine test strips, it was just over 5,000. And for methamphetamine test strips, it was a partial year since we just started with those strips, and there were just over 2,000 distributed. We also are the provider of a statewide mailing program that distributes naloxone and these test strips as a contracted service with DDAP. Those numbers are not included in the data that I've provided here to you. And then in our MOUD program, or our treatment program, we do this in partnership with the Allegheny Health Network Center for Inclusion Health, and it is the only free low-barrier opioid use disorder treatment program that goes out into the communities and treats people in the neighborhoods where they live. We saw 241 new individuals initiated on buprenorphine in this treatment program, 650 returning patients, and a total of 3,640 visits in calendar year 2025. And then lastly, our STI testing program data. This service is provided in conjunction with Allies for Health and Wellbeing. And we had 123 unique individuals tested, and you can see the results for the different types of tests that are offered. In past years, we have seen higher reactivity in the hepatitis C tests. In this case, we believe that since we are testing people who are going to a harm reduction intervention where they're receiving the types of supplies that can prevent them from getting hepatitis C, that some years we have very, very low numbers, and in other years it's a handful. So we'll get into what changed. Why did we see this drop in syringes? Of course, much remains to be seen as more and more data comes out, but there appears to be an emerging national trend where individuals who use drugs are injecting less and are using opioids less. There is a significant increase in smoking, and there is a significant increase in stimulant use on the other side of this trend. our distribution data for 2025 showed that there was about a 30% increase in individuals who received no syringes in 2025. And this is because in addition to syringes, we offer safer smoking and snorting supplies so that people have sterile equipment regardless of what way they're using their substance. This corresponded with a 36, almost 37% drop in the number of syringes distributed over the previous year. We have a qualitative survey of our participants in progress, but the preliminary data confirms that there has been a significant shift away from opioid use and injection overall. So what does this all mean? Some of this overlaps with what was said in the previous presentation, and I appreciate the context that some of those discussions provided. Overdose fatalities are still too high. We are not seeing the dramatic increase year over year that we were seeing in past years, but we are still well above what we had seen historically and what should be considered acceptable. We have to continue to scale and maintain the things that are working, and also to innovate and seek new ideas and basically respond to the changing situations that people who use drugs are living in order to effectively address some of the social determinants of health and things that were mentioned earlier. The opioid supply is highly variable. We have a drug checking program where we send samples to a lab to be analyzed. Some of that data does come through the county. And so some of the data referred to earlier included those samples that we sent out for testing. New synthetic opioids and other contaminants are coming in at unprecedented rates. Not only did we see the shift from opioids to the tranquilizers like xylazine and medetomidine, but we are also seeing things like industrial plastics and other very bizarre chemicals that we don't truly understand what their impact is going to be on the human body. There's a total lack of resources for treating stimulant use disorder. This has historically been true, but now with the increases that we're seeing, this is something that we really need to focus on. There's no FDA-approved medication for treatment. There's no over-the-counter overdose antidote like naloxone is for opioids, and there are very few specialized treatment programs that are set up to deal with the particular needs of people who are using stimulants. Some considerations for the future is that the current supply that was traditionally dope or heroin, the opioid supply, is actually very weak on opioids. But that doesn't mean it's going to stay that way. It could very well be that the reintroduction of fentanyl at previously normal amounts would cause a spike in overdoses. We also are aware of different synthetic opioids that are emerging into the drug supply, and our drug checking shows that they are becoming present here. Nitazines and orphines are the two classes of synthetic opioids that are of most concern right now. Of course, this has been touched on as well, but cuts to funding and policy changes in human services and public health sectors are only going to result in greater morbidity and mortality associated with substance use, and so I think it calls for us to really get back to the basics. We know federal funding is going away, and so we need to identify the local funding that we have to support these crucial initiatives that keep people alive and well. High quality and low barrier treatment, overdose prevention, harm reduction, public health interventions of all kinds need to continue at not just the current level, but be invested in a way that we can continue to respond to all of the shifts that we're seeing in the drug supply. Of course, the incoming cuts to Medicaid and Medicare are going to put great strain on all of the safety net resources. Us being one of the only free treatment programs kind of see a tidal wave coming our way and people losing their benefits and needing to maintain their treatment. Unfortunately, the resources for providing low barrier or free treatment have not increased over the years, and the pot of money that DHS has for paying for some of those uncompensated services has remained the same. We were talking a little bit about metatonin withdrawal earlier. Certainly, the advice to go to the emergency department is some of the best advice we can give, but it's with the understanding that emergency departments are not all created equal. Their capabilities, their attitudes, and their staff may vary significantly. We may also encounter situations where like a treatment provider provides a medically supervised detox program, but they have not integrated the metatonin protocols. One of the medications that's given during the detox is dexmedetomidine, and this is only able to be given in ICUs currently, and so there's a limitation as to where it can be prescribed and dispensed. That hasn't stopped some of the treatment providers from knowingly admitting people into their programs, putting them through traditional detox protocols, and then having people sent to the hospital with heart attacks or death. So there's much more to be done in making sure that we manage the issues with metatonin withdrawal in a more standardized way, making sure that there's a standard of care for people, that criminalization is not part of the response to a medical need. And there's much more to be done on morbidity, even though our mortality is down. We have all sorts of wounds from xylazine or unsterile injection practices. We see people who have significant sedation and victimization as a result from being exposed to the tranquilizers and possibly being unconscious in a public space or in a place where somebody's not looking out for their well-being. And to get back to the very beginning, HIV, hepatitis C, and other infectious diseases, we know the resources for those are diminishing. Thankfully, a new syringe is a wonderful prevention tool for HIV and hepatitis C, but with testing and treatment resources going away, we will certainly see an uptick in transmission. Happy to take any questions.
Thank you very much. I have a question, but I'm gonna let others ask questions first. Dr. Snyder seems pretty eager. Did you have your hand up? Oh, no, I'm sorry, Dr. Yonas. I saw your hand.
I just want to say there is a second part to this, but I wanted to pause for questions too.
Okay, that's helpful. Thank you.
I'll be really quick with my question, and I was really happy to hear you were coming today, and also for the update and the incredible work. And it's really interesting to learn and important to think about these trends and the importance of surveillance and the relationship you have with all the structures. I'm really interested in a different stimulant unregulated with kratom, and its impact as a low-dose stimulant, high-dose depressant. It's highly dependent, and just wondering your thoughts as it's become more and more evident, particularly when youth populations and the intersection with violence and conflict in schools and others. So just wondering how that, if you see that affecting the population, in what way, and maybe Dr. Cuevas might know as well. I'm just curious.
I think with those sorts of products, it's important to distinguish, kratom, what is sold as kratom or kratom is often, well, it's not regulated. And so you can put a lot of different things in a package and call it that. One of the versions that we're seeing now is purely a synthetic opioid, 7-OH. It is being sold in retail locations, no ID or age restrictions, that sort of thing. And so that is a huge concern, is that we do see these unregulated products out there. Of course, the answer isn't necessarily criminalizing the people who use them, but I think we need to do a better job of understanding why people are attracted to these products in the first place. Sort of what purpose are they serving? Like you said, with youth, I don't have a particular opinion on that because we tend to see more of an adult population in our program. Though, anybody can come to receive services from us. But I do think, we have heard from people that are concerned parents wondering, does my kid have to go to a special program? I don't know anything about this drug. And so I think there's just a lack of information about sort of what to do in a situation where somebody does develop problematic use of some of the unregulated products like that.
Yeah, feels like a really emergent space. Thank you for that.
Sorry, I'm still digesting that last part of the conversation. You said retail locations, as in
Yes.
stores. Yeah, Dr. Cuevas, I would love to hear your comment on this.
Just a quick comment, I think having a resource like Prevention Point Pittsburgh is pretty remarkable in Allegheny County because they have become a trusted resource and something that people can easily find. That I've seen parents who have had children with a freedom use reach out to Prevention Point for help because they didn't know where else to go. So I think having them with at the ready, able to answer a phone and give resources, and it may not be that the person needs to go to Prevention Point for services, but they have become a go-to in some situations for some people.
I'm interested in the, and thank you, Dr. Cuevas. I'm interested in the program referral data. This came up in a question earlier, but you mentioned that you've had 241 individuals, new individuals, 650 returning patients in the MOED program. And you also mentioned that there were 523 new individuals interacting with the Syringe Services Program in general, and many thousands more interacting as repeated folks. Do you have a sense for who is being referred? Is it the folks who are coming to you for the first time? Is it folks who are returning, or is it both?
Being referred to the treatment.
Referred from, yeah.
So they're actually co-located at our site locations. And so quite literally, Tuesday through Friday, our sites look like vans parked in community areas. And you can see the site locations there by day. On Sundays in East Liberty, we are actually indoors at Allies for Health and Wellbeing, so it's a little bit different of a setup there. But the treatment van sits directly next to the SSP van, and so the SSP sites existed before we brought the treatment services to them. And so it was kind of a model where we were looking to incorporate harm reduction and more traditional treatment, but also to lower the barrier to entry for treatment and really take care of things like transportation. We don't require insurance for somebody to start treatment. Dr. Cuevas is actually a provider on the van 1 day a week. I don't know if there's anything else that you wanted to add to that response.
I feel like I should abstain, but because Erin, you're doing a great job. I think the opportunity is if somebody wants treatment, we're there right there, and we can immediately offer treatment. And I think that's again some of the advantage of being there. Again, where no insurance is required, but people have the opportunity to get on insurance. I think the medetomidine issue is a big one, and when we're seeing difficulty in getting people on medications.
I think as well, we do not have appointments. Typically if you appear at the location, you will be seen by the provider that day.
Yeah, I was just curious as to whether it was folks coming to any services for the first time that were primarily enrolling in the treatment program, or whether it was folks who are returning as well.
Oh, okay. Yeah, I would say it's a mix. Yeah.
I'm gonna let you go ahead with your presentation on the Syringe Services Program, and then we'll wrap up with
This is just some quick updates and a heads up as well. So as I mentioned, these are our 5 locations in Pittsburgh. We are at these, as I said, Sundays, we are indoors, but Tuesday through Fridays, we are in outreach vehicles in community locations. We had 2 situations in the last year where we had to temporarily relocate the site where the SSP is operating because things were happening with the host locations that were sort of out of our hands. So what we're doing now is working with a city council member who oversees both of these site locations to get the necessary approvals to make these permanent locations, and then we'll return to you with a request once that step is completed to make sure that that all is squared away and documented for the future. The Sunday site is our oldest site. It's been operating since May 21st of 1995. It's been in various locations, including former health department buildings on Forbes Avenue, but most recently is with Allies for Health and Wellbeing, which is a wonderful community partner of ours. The Allies had to move due to a lease issue in their current location, and they moved approximately a block and a half, as you can see here, to an office tower directly behind their previous location, and we moved along with them. Very grateful to be able to maintain that service. Because the Sunday site has been in operation for so long, anybody that knows about Prevention Point knows the Sunday site. The second one is in Homewood, and we've been operating this site at the previous location since 2020. And unfortunately, the property that was on that location was experiencing some issues with repeated break-ins as they were trying to get it ready for renovations. So the property owner discontinued having any outreach services come there. We were not the only ones coming to that location. There were several other organizations that also came on other days, and other organizations that would sometimes join us for a one-off or a pop-up, that sort of thing. We stopped running the site in January of this year and reopened in April of 2026 at Bethany Community Ministries, which is also still in Homewood and just about 0.7 of a mile down the road. This partnership has actually worked really great. It's operating at the same time as a free hot lunch service, where they also have some basic needs available, and our testing partner, Allies for Health and Wellbeing, instead of being there just once a month, can now be there every week when we're there on Fridays, because there's an indoor space and bathrooms that they can utilize for their testing process. And happy to take any questions on that portion.
Okay, any final questions for Mr. Arnold? Okay. Thank you very much for that update. Very appreciated. Before we move into new business, we're going to take a little bit of a break here for, let's call it 6 minutes. So that would be 2:23. Reconvene. Thank you. Stretch, be well.
Good to see you.
On the last slide, he had. Did he have your?
And I'm like, so sometimes
I just didn't know how we
I know there's a two point
Everyone start to find your seats again, please. Okay, let us reconvene. Thank you all. We have 7 action items for the board today. So let's get started. Mr. Otis Pitts will be presenting the first 3.
It's 4 actually. 2 advisory committee votes and then 2 regulatory votes.
Oh, okay. Oh, yes, you're right. I'm sorry. Yeah. Yep. Okay, I take it back. There are 8 items for both.
So, good afternoon. So today we're asking for the board support and renewing the terms for our food safety advisory committee members. There's 5 in particular that we're asking for your support to renew. According to section 350 of Article 3, which governs our local food work, the director has the authority to appoint these members for this committee. However, in the event that they're interested in renewing their membership, the board has that purview. So today we're coming to you for your support to renew the terms of 5 members. Those members are as follows: Steve Luciano, Matt Anselmo, Nicolette Skudik, Brian Eaton, and Charlize McKinney. The board was provided short bios for all these members, but they've all been very central to the progress of our food program during my time here. They were very central in helping us revise Article 3 for the first time in 25 years. Just a few years ago, revise our entire food safety fee schedule, which was a major undertaking. And you heard some of that from Mr. Musciano and Matt Anselmo during your March meeting down in the valley. So again, these members have our full support and endorsement, and they'll hopefully continue to be a big part of what this committee does. We're allowed up to 17 members on this committee. So these 5 would join the other 6 that were just appointed just over a year ago. And we'll continue recruiting for the few vacancies that we have. As we told the board members recently, we don't know if we'll get to 17, but we do hope to add a few more members to the 11 in the event that you give your support today for those 5. So again, with that, I'll turn it over to the board. We could vote as a block on these 5 members or individually, if you prefer.
I'm gonna suggest we vote as a block. We would need a motion for that, but before that, is there any discussion about these 5 proposed members for the food, or for renewing membership to the Food Safety Advisory Committee?
Just to, again, orient the members, so on behalf of the Policy and Procedures Committee, so our statutory requirement as a board is not to appoint these members, but to renew the terms of those who have had an expired initial 3-year term. And talking with both, Mr. Anselmo in particular, who's taken up the chairmanship of that, the Food Safety Advisory Committee really is working hard to recruit great people from the community to serve on that. It's a volunteer job. We appreciate it very much. And so while I don't think we are 100% within what is required by law, a 3-year term with a 2-year renewal, we're getting there.
Thanks very much, Dr. Snyder. Any further discussion or questions?
Not discussion, but just to note that as volunteers, these group of individuals have been doing a really great job. And as we've seen, and if you look at their bios, you know, they are experts in this area, and they've been doing a great job for us. So I just want to say kudos to them.
They're fantastic, and as the board knows better than anyone, there's a lot of work behind the scenes in getting ready for these meetings. And our food committee was very instrumental in reviewing one of our larger sections, Article 3, which is almost 100 pages, and providing edits on an entire rewrite that we passed 3 years ago. So but that was just a huge, huge task for them.
Yeah. Any additional comments or questions? Dr. Mendez?
Yeah, I wanted to know if there's an age limit or requirement, minimum age requirement
Nothing
for
to
this
say.
committee, and if there are considerations of youth who may have limited experience but have vetted interest in this work.
In that case, I'm sure we would seek parental consent, but Article 3 does not state any sort of age limit.
That's a really interesting consideration. Thank you for elevating that. Any other comments or questions? Okay, can I have a motion to approve the slate of board members for the Food Safety Committee?
So moved.
Thank you. A second?
Second.
Thank you. All in favor? Aye.
Aye.
Any opposed? Any abstentions? Okay, motion passes. Food safety members are approved
Thank you.
as proposed. Next
Next
up.
up, so in a similar spirit, we're asking for your support to renew the terms of 8 of our plumbing advisory committee members. And again, the board should have the short bios for all these members. And admittedly, it's been some time since the health department has come to the Board of Health asking for any renewals for our plumbing committee. In some cases, members have served for a couple of decades. So our hope today is to get those members in good standing under or covered by 3-year terms, which in many cases might be their last term, which would allow us to do some recruiting to fill those vacancies during this 3-year span. In addition to those 8 positions and the recruiting for those positions, there's also 2 vacancies that we're actively trying to fill. As you may know, plumbing is very different because there's specified niches for every single member. They must come from a certain field or area of expertise. And currently we have vacancies for the architects on this committee, as well as someone from the Allegheny County League of Municipalities. So we made some small strides in filling those recently. But once we get some names, and better context for those individuals, will be coming to the board asking for your support for those 2 members. But today's task, again, is to just get support and renew the terms for the 8 members before you today. And those members are as follows: Ed Bigley, John Cummins, Jim Eichenlaub, John Moffitt, John Inks, Ruth Ann Omer, Reggie Klaus, and David Green. So with that, again, we're asking for the board to support this slate of members for a renewed 3-year term.
Okay. Thank you very much. And let me also just say thank you to you and to the staff who are engaging with the folks on these advisory committees frequently and doing the work to select and present these folks for our approval. And I also want to thank Dr. Snyder for chairing the Policy and Procedures Committee and making sure that the board is evaluating these and taking a look and making sure these members are brought into good standing, as you say.
I'm sorry. I should also note that you heard from John Cummins just, again, this past spring. He had a lot to say about the committee and the progress. And I think you saw just how committed he was to this work.
Yes, thank you. That's another very good point. Is there further comment, discussion, questions from the committee? Dr. Snyder?
Yeah, I'll again make a very similar comment. In this case, Allegheny County Code says that the board appoints these members. There's like 9 different types of individuals that are specified, and these are committed people to what they do, and again, volunteering their time. Hard to recruit volunteer time for this. So we are, the Policy and Procedures Committee, in addition to getting us back on track for what we should be doing from a statutory requirement, are committed to working with our colleagues in the field to see what we can do with recruitment, or maybe propose a change to the code to make it a little easier for people to serve terms without having to be renewed, etc. So all of this is in the works, but I would endorse approval of these renewals, even though we've had some time, as you probably saw, since that they've been, and as Mr. Pitts mentioned, they've been serving as we get to a transition here.
Any further discussion or questions? I actually did have a question. Is there some mechanism by which we can, that we're in communication with the folks on these committees to make sure that things like attendance and participation are something that they're aware of, that needs, that there are
Certainly,
expectations?
we'll stress that tomorrow. The next meeting for this body, for the plumbing committee, is tomorrow. And I'll remind them that we'll be watching and keeping track of their attendance.
Okay. Sounds good. Okay, if no, Dr. Lucas
The other
Becker.
thing, in addition to that, because we know they're very committed, that we think about how we can recognize them in some way, as we go along. That may not be part of our committee grant, but at some point, that we need to recognize them in some way.
I think the board made a huge step of that when you invited them to the meeting this past spring. They really appreciated that opportunity.
So Mr. Pitts, could you just restate the 2 vacancies and what the process would be if people have recommendations for those vacancies?
Sure. So according to Article 15, one vacancy that we have currently is an architect or someone from that sector, and also a representative from the Allegheny County League of Municipalities. All other positions are currently filled.
And the recommendation come to you?
What is the process for, if someone had a recommendation?
So we would work closely with the committee. I think the plumbing program would really take this on and find someone, maybe share with people on the plumbing committee, but it's really up to the department to find someone that's a good fit, bring them to you, and with our endorsement, and ask for your vote to appoint them.
I think she has someone in mind.
Maybe.
If that's the
It
case,
sounds
then
like-
please,
yeah,
bring it to
it
Dr.
sounds like
Rand's attention, my attention.
Okay.
Yeah,
all
it
of
sounds
them.
like share it with Mr. Pitts. Any further discussion? All right, can I have a motion to approve the slate of plumbing candidates, plumbing advisory board candidates?
So moved. Second?
Okay, I'm not sure how that was recorded, but I heard a motion and a second. All in favor? Aye. Any opposed? Any abstentions? Okay, motion passes. Plumbing slate is approved.
Thank you.
Moving on to Article 15.
Let's have 6 here. I just jumped.
Oh, I'm sorry.
Just-
I jumped. That's on me. Article 6, Housing and Community Environment, and then Article 15, plumbing slate.
So switching gears just a little bit here, we're asking for the board's final vote on our latest Article 6 update. This is the update to Article 6 that codifies our ability to rehouse families and tenants living through or facing emergency housing conditions. And the framework for this is really laying out a protocol for notifying property owners of what we're asking them to, or requesting them to do. One, either meet the emergency, make the necessary repairs for the apartments or the housing, or rehouse those tenants for the duration of the emergency. If they're unable to do that, the county is positioned and willing to step in and rehouse those families and those tenants for them, and then bill the owner for the cost of the hotel or whatever it ends up being, all the logistics associated with that short-term rehousing. So this language in Article 6 that we've added to Section 618 really just clarifies existing authority that we have. In fact, this is authority we used last year during a bad winter storm. It's something we had to use this past spring, in May actually, when a tenant was facing a sewage backup. So it's authority that's well documented. We're just simply putting it in Article 6 for everyone's interest. So it's crystal clear on how this would work, how we would advise the property owner, and then what we can do in the event they don't act. In theory, this is a tool that we would only use in very extraordinary circumstances. Again, it's really when there's an emergency housing situation, featuring usually like a number of violations, not just one single violation, but it could be a sewage backup. It could be an extended period of no heat during freezing temperatures. It's really up for our housing team to bring it to my attention, Dr. Van's attention, and if it's such that it warrants this kind of action, we'll make that decision. And again, that decision is first to notify the owner that we expect either the repairs or them to rehouse, and if they can't do that, then we step in and do it for them in the interest of the tenants. So we had a 30-day public comment period on this one. Did receive a fair number, just over 10 comments for this revision, largely supportive of the edits. But I'm happy to answer any questions the board may have. But again, this is something we're eager to get on the books because it also, in theory, could also incentivize more property owners to act. This is not something we want to do as a county or as a health department. We want the owners to take this action, make repairs or rehouse, and keep us out of it, honestly. So, again, happy to answer any questions or take any comments.
Comments, questions, discussion from the board? Dr. Snyder?
Mr. Pitts, I agree that the public comments were overwhelmingly in favor of this. There was one comment that thought that the proposal was, quote, vague and overbroad, and and expressed concern that one individual has, quote, subjective discretion, unquote, to enforce it. How would you respond to that feedback?
I think that one comment came from someone that I would consider a special interest, someone from the ownership side, I think a property owner association. But no, we do not believe this language is vague at all. It's really clarifying existing authority. So we're actually trying to take something that may be vague and make it not so vague with this edit here. Make it very clear that the county is well positioned and we have every intention on taking care of our residents if property owners can't do so. Again, they have two choices. They could meet the emergency condition, make the repairs, or they can rehouse the tenants on their own. If they can't, as you saw Dr. Van's slide early on, it's our, not just authority, but it's our obligation to take care of the public. So it's just a simple exercise of that authority.
Any additional questions or comment? Dr. Yonas?
Mr. Pitts, thank you so much. Quick question also similarly in terms of some of the feedback received. One of the questions was, and maybe just curious if you could clarify, provide some context to the relationship with the county manager now and through this ordinance, and then how that, if there are any differences in just the thought process in that.
Sure, I'm sorry, that was brought to the previous question as well. So that language you're referring to, where it's at the county manager's discretion on which departments may help with this. That's just a simple acknowledgement that we don't do this on our own, just like everyday work at the health department. We turn to our county partners, be it county jail, emergency services, fire. We can't house everyone on our own under this authority. We would turn to partners, maybe emergency services. It could be the Department of Human Services that exercises some case management due to their existing connections with certain families and certain tenants. And we don't do this alone. And that goes for anything we do as a health department. We turn to all sorts of governmental partners, and that's just a simple acknowledgement that human services may be doing some case management, fire may be doing some relocation, and that's all. The enforcement work will come from us, the health department, but it actually to get families situated in safe environments, it does take more than just our health department.
Very helpful. Yeah, thank you very much.
Okay, any additional questions or comments? Okay, can I have a motion to approve this housing and community environment revision?
Thank you. Motion.
Do I have a second?
A second?
All in favor? Aye.
Aye.
Any opposed? Any abstentions? Okay, motion passes. Thank you. Okay, next is Article 15, plumbing code revision.
So this is another request for a final vote following public comment, and this pertains to Article 15, which is the plumbing code. So just a quick refresher for the board's sake and the public's sake. Last year, we passed and adopted a set of updates to our plumbing code. One of those provisions created a framework for us to conduct oversight of what's called cured in place pipe or sewer liners, which features a resin that's kind of introduced into a compromised or filled pipe. It heals the section of the compromised pipe. So thankfully to that revision that was passed last year, we now have that oversight and ability. But as our team got into this work and got into the weeds of coming up with a workable enforcement model, we realized that the standards that we had on the books just were not feasible at this moment. So we proposed adding other industry-leading standards, these ASTM numbers, which refers to the American Society of Testing Materials, a well-trusted organization that tests all sorts of industrial products. So we're proposing to add other industry-leading standards for that resin and methodologies used to get the resin into these pipes. To do that, or to find those other standards, we looked at other jurisdictions. For instance, we looked at New York State. We also looked at other leading model codes. We happen to follow the International Plumbing Code here, but there are almost 20 states that follow the Universal Plumbing Code. And in that code, they also adopt these other standards that speak to the nature and the type of resin used and the methodologies used to introduce it to the filled pipe. So this set of updates, again, it adds those other standards that speaks to the resin products. And it also goes even further because we're adding a definition for photo-initiated cure, which speaks to how the resin is hardened. The photo-initiated covers a range of methodologies, but essentially it's far quicker, cleaner, safer than the steam and hot water methods often used, and that can create more vapor. As we said last time around, based on our research, we would be the first jurisdiction that makes that standard or codifies that in our code to require photo-initiated cure. So we opened this one up for public comments. We got one comment on this one, which was vaguely supportive of the initiative. And I'm happy to engage the board on any questions and comments. But this is also an update that our Plumbing Advisory Committee supported, and the language has not changed since they last saw it.
Okay, any comments, questions, or discussion? All right, seems pretty straightforward. Thank you for the review. Can I have a motion to approve?
Motion to approve.
Can I have a second?
Second.
Great. All in favor? Aye. Any opposed? Any abstentions? Okay, Article 15, land code revision is passed. Thank you. And thank you for all the presentations. Our next presentation is Environmental Health Fund request, presented by Ms. Joy Smallwood.
Good afternoon, my name's Joy Smallwood, and I work.
Is the microphone on?
You turned it off or on?
Put it on, sorry.
My name's Joy Smallwood, I'm an environmental health administrator with the Water Pollution Control and Solid Waste Program. Today, Michael Hills, president of the Pittsburgh Safe Boating Commission, will present his request, environmental health fund request for $35,000. So, you wanna join me up here, Michael?
Well, thank you everybody for having me at me. Thanks to Joy, and for inviting me to the meeting, and also for considering this environmental health fund request. I'm here today to speak specifically to the environmental health and safety hazards around abandoned, derelict, and sunken vessels or boats in the Pittsburgh and Allegheny County region. Just a little bit first about what the Pittsburgh Safe Boating Council is. We are a nonprofit consortium of recreational and boating businesses, marine-oriented organizations, law enforcement, elected officials, and government agencies. We consider commercial and recreational boating traffic in the Pittsburgh area, facilities, laws, rules, observed practices, and our goal is to bring ideas to the table for the sake of improving environmental health of our waterways and also boater safety. The members of our council include marine-oriented businesses, boat sales organizations, kayak and boat rental companies, charter companies, tour boats, marina owners, marine salvage businesses, commercial hauling, barging, marine construction, those kind of folks. We also have plenty of organizations on our council: Port of Pittsburgh Commission, Three Rivers Waterkeeper, Allegheny Cleanways, Venture Outdoors, Friends of the Riverfront, Sports and Exhibition Commission, Three Rivers Rowing Association, Point of Pittsburgh Sailing League, those kinds of folks. And we have law enforcement such as the PA Fish and Boat Commission law enforcement, U.S. Coast Guard, River Rescue, Army Corps of Engineers, and elected officials all on our council. The impact we've had over the last 5 years includes lots of things, including mainly informing the boating public about safe boating practices. We've raised concerns for environmental and safety issues around the lock and dam removal project on the Monongahela River. We've had safety navigational aids for boaters installed on the Allegheny, as well as safety ladders installed on the seawalls on the Allegheny, just as some examples of things that we do. We're also a bit of a press machine. We are the go-to source for any questions that local TV, radio, and newspapers have about boater safety concerns, and we hold annual press conferences for National Safe Boating Week and also Operation Dry Water. So that's about the Pittsburgh Safe Boating Council. I think the key thing that we're most proud of in the past couple of years is our effort to bring forth concerns about abandoned and derelict and sunken boats, and specifically environmental and safety hazards there. That culminated in what is Act 28, which was signed into law by Governor Josh Shapiro last July and went into effect in January. Representative Kulik and a group of about 16 senators and representatives, bipartisan group, helped push that through the House and Senate last year. So what is Act 28? This is the most important part. Act 28 is a law that gives some teeth behind removing the environmental hazards that are abandoned and sunk vessels. It empowers local law enforcement and municipalities to remove, store, or junk derelict or abandoned boats, and the law establishes, most importantly, penalties and also restitution for disposal costs for boat owners who abandon them. In the past, removing an abandoned or derelict boat was almost impossible. It was a 6-month to a year-long process. The liability around attempting to remove the boat and the jurisdiction was completely unclear. So for example, if a boat is tied to and sunk on the North Shore of Pittsburgh, it's in federal waters, in Allegheny County, in the city of Pittsburgh, on the sports and exhibition public wall. Who has the jurisdiction and who holds the liability for removing a boat that's an environmental disaster? Nobody knew. So the law put some teeth behind that, and it has defined what an abandoned and derelict vessel is. It has defined that there needs to be a 14-day notification process to the owner, and that owner has 30 days to remove it, or they lose the rights to claim liability or even the ability to claim the boat once it's gone past that period. After that period, a salvor can go get the boat and remove it and either store it, junk it, or landfill it. So before we had almost no ability to, now we can remove an environmental disaster in 30 to 45 days. After the law was set up, the state set up a page on the on the Commonwealth of PA website that gives municipalities and law enforcement a place to report an abandoned or derelict vessel, and also defines how Act 28 works and what can be done about that boat. So it's one thing to pass a law, and it's another thing to give municipalities the ability and a way to report abandoned and derelict vessels. It's a whole other thing to figure out what to do with them. So the Pittsburgh Safe Boating Council put together an ABV Enforcement and Resources Committee at the beginning of this year. The goal was to develop steps and resources to figure out how to remove these boats and what to do with them. We aren't involved in the notification or the enforcement. We leave that to municipal law enforcement and the PA Fish and Boat Commission. What we did do was meet with 5 marine salvage companies and learn from them and set up steps that can be taken to remove, raise in many cases, tow, get fluids like oil and gas out of these boats, take them to a salvage yard, dismantle them, scrap them, and or landfill them. So they helped us figure that stuff out, and our goal now is to educate municipalities and their law enforcement about what they can do with these steps and who those salvors are and what Act 28 allows them to do in terms of removing abandoned derelict vessels. One of the things that we learned in our process was that the average cost of removing an abandoned and derelict vessel is somewhere between $5,000 and $20,000 a boat. So for example, we just had a boat before the NFL draft removed from the North Shore wall. It was a 42-foot boat. It had 400 gallons of diesel fuel in it. It was days away from sinking. It cost them towboat US $15,000 to remove the boat. If they hadn't removed that boat and they had to use special floating equipment to even get it up out of the water and move it, they had the opinion that the boat would have been underwater and leaking 400 gallons of diesel fuel into our rivers within a week. So we've learned a lot. That map is a map of the 18 to 20 boats that are in the immediate 5 to 10 nautical mile area on our 3 rivers from downtown Pittsburgh. It does not include ones outside of that, and it does not include abandoned vessels that are on land on a lot of our public streets or public launches or in parks. For now, we're focused specifically at the Pittsburgh Safe Boating Council about the ones that are in the water and sunk or partially sunk. The impact of these vessels is perhaps obvious, but there's long-term impacts on drinking water, swimming and fishing waters, and health and public safety hazards, including leaking fuel, diesel, gasoline, oil, antifreeze, for example, heavy metals from the bottom paint, electronics, batteries, and all the copper, lead, mercury, and zinc that is embedded into our river and lake beds. As a result, marine toilet storage tanks that leak, marine hazardous materials, specifically regarding the hulls of the boats that expose fiberglass, asbestos, and those kinds of things directly into the marine ecosystem. Contaminated seafood is one of the key results, so local fish are dangerous for human consumption, as well as contaminated swimming waters. There are also plenty of navigational hazards for those of us like me who go boating on our three rivers. Partially submerged or sunken vessels can be immediate and dangerous situations when you run into them. There's also sharp debris from splintered fiberglass and other parts of the boat that impact swimmers in our rivers, and stagnant water. The trapped pools of water inside these partially sunken vessels and their cabins act as breeding grounds for mosquitoes, for example, and rotting organic matter and untreated onboard sewage systems on these boats also end up in pathogen spreading. So that's the issue. We as a council are trying to raise about $250,000 to help us pull the 18 to 20 boats that are in that immediate 5 to 10 mile area. That doesn't deal with land boats, and it doesn't deal with future vessels that people unfortunately will probably abandon, but at least it'll get us started. Our request from the Environmental Health Fund is $35,000, really just to get us started. Core thing on this, many municipalities don't have the money to deal with them themselves. Some do, some don't, but many of them are just now learning about Act 28 and obviously have never thought about putting funds in their annual budgets. So where needed, we're looking to help them out. That $35,000 would pay for about 3 to 5 additional boats. I think we pulled about 15 statewide and at least 5 in Pittsburgh so far. This would be 3 to 5 more. The $35,000 would cover the cost of raising the boats, removing fluids, towing the boats, dismantling, and landfilling them. And it would also give us a chance to talk about funds that we have raised and hopefully ask for matching funds from other grant organizations and the PA State Fish and Boat Commission. Benefits. Our goal is to start with the 3 to 5 most environmentally at-risk vessels near downtown. Allegheny Clean Waste and Three River Water Keepers, they're the ones that put that map together for us, and they know the ones that are most environmentally dangerous. So we would start with those 3 to 5. Another benefit is we intend to do press coverage like we always do for this and our other efforts, and press coverage around the penalties for removal of these boats hopefully will help slow or reduce the number of people that abandon their vessels here forward. And of course, recognition of our partnership with the Allegheny County Health Department. Next steps, if you approve the $35,000 funds to get us started, would be to notify the municipalities, not specifically that there are funds available, but that they should be, and there is a way for them to address abandoned and derelict boats. But for those that don't have funds, we will circle back and be able to provide some for them. They, with our help, would hire 1 of 5 different marine salvors and pull the boats and deal with them. That's my presentation.
Thank you very much for that presentation about an issue that does not come before us very often, so I appreciate the background. I think there are probably going to be 2 questions. One is about what the current status of the Environmental Health Fund is, and the other is just a question about the color coding for the boats on that map. Is that in the severity of the?
Yes, that's the condition of the boat, like whether it is sunk, partially sunk, fully submerged, and how difficult it will be to get to. So I don't remember exactly what the colors are. Three Rivers Waterkeeper put that together, but that's really to help to inform the marine salvors what they're going to be in for.
Interesting.
Kim, do you? 586,000.
Okay, this is what's currently in the Environmental Health Fund. Other questions, discussion, Dr. Younes?
Just wondering also in terms of guidelines for the use of the Environmental Health Fund, I assume this falls into those guidelines and is appropriate, so that's good. I did have a question. You mentioned around statewide work. Is it assumed that those dollars will be used for just local Allegheny County salvage efforts?
Yeah, the abandoned and derelict vessel issue is an issue in all 50 states and certainly in Pennsylvania. By the way, that Act 28 is one of only a couple of states in the country that's actually passed something that clear, so we're really proud of that. but the funds that we're requesting is specifically for Allegheny County.
Yeah, thank you, that's helpful. One random comment is I serve on the Region 13 River Rescue and River Rescue Team. We're constantly called to boats that come free when there are storms, float down the river, bang into things, hurt people, cause damage. They leak, they're a fire hazard, so thank you for bringing this forward.
You know, one more funny comment. We were doing a hearing before the PA Fish and Boat Commission and Representative Kulik and a bunch of other senators and reps. And it was at the Carnegie Science Center, and it was after a major storm 2 years ago. And an abandoned and derelict vessel floated by, half sunk, while we were doing the presentation.
And you didn't plan that?
Didn't plan it.
Thank you. Other questions, Dr. Spellman?
I am wondering, does the city involve in the cleaning of these boats?
Yes, the city is involved. They're more involved from the standpoint of removing abandoned and derelict vessels that are left on land, like at the south side boat launch, for example. There's 20 of them there right now.
Okay.
The city will get involved, but only if it is on public lands or city lands where that boat is sunk. You know, an example would be the North Shore Wall that the Sports and Exhibition Commission is involved in. They were involved and the city was involved in the removal of that boat.
Okay.
Dr. Clevis?
Do the penalties that Law 28 allows for cover the cost of removal of the boats in the future? And then the boats that are currently in the river system, can you identify the owners and charge penalties to those owners so that there's sustainability and we don't have to continue to provide funding for this?
Yes, there's a $500 penalty for the boat owner, plus they're responsible for the cost of restitution, which, as we said, could be anywhere from $5,000 to $20,000. There's two problems with it. One is, by the time these boats get to this state, they're in this state because the people who own them can't afford to repair them. And you'd think that they would donate them, give them away, do anything other than abandon them, but in many cases, they literally just cut the cord and push them out into the river. So that's that problem. In terms of identification, that is actually not too difficult. In 90% of the cases, there is either a hull number, which is like a VIN on your car, or registration like your license plate on your car on the boat, and they can, Pennsylvania Fish and Boat Commission, through their resources, can identify either the current owner or prior owners and try to back into it that way. In most cases, they can identify them. If they cannot, then they can, the law allows them to use a public notice period in a local newspaper.
I'm wondering, in terms of hazards, do you have records of how many boats are sunk and causing these problems? No, a much harder question than that.
That is
But I don't know how long you've been tracking this. Boats that are
Well,
sunk.
Three Rivers Waterkeeper has been tracking that immediate area that I was talking about for the past 5 years, I think, and that's how they identified the 20 that they know they're there right now. That doesn't include some that might be 20 feet deep and we don't know about. Some of the smaller waterways or lakes are really difficult to track, and city streets and public parks where, especially where there's a boat ramp, those are even more difficult because it's difficult to ascertain which one's an abandoned boat and which one's just there for the afternoon before they put it in the water. So a hard question to answer, but the Safe Boating Council specifically wants to deal with the ones that we know that are an immediate threat, that are in the water, and hopefully prevent that from happening in the future.
Dr. Snyder?
Commendations on your efforts to find a diverse source of funding. Impressive to see some 12 or 18 or whatever it was in there. It's terrific. So I'm glad that we would be part of that effort. Unequivocally, addressing this issue is beneficial for the environment and health. I have two questions related to that, though. I want to avoid using our money to shift the problem somewhere else. So reduce, reuse, recycle. You're addressing, preventing this from happening. How do we not just landfill the boats?
Well, that is an excellent question. The initial idea is to landfill because some of these boats are in such bad shape that there's no redeemable value. It's unlike an abandoned car where you can, park the thing out and probably get some value on it. Most of these boats are so bad that there's literally no value. That being said, can you repeat your question for me?
Well, I was hoping that as we get these abandoned boats out of an unhealthy, environmentally unsound situation, that we do the best that we can with the waste, instead of, and landfill that may be the only option, but maybe there are better options.
Yeah, we did, through my contacts as a recycling coordinator, I did reach out to the recycling market contact that I have, and there are no current fiberglass markets in this area. And anything metal is being scrapped, those type of things, so at least, that's not all just going to landfill.
There is another possibility as well. The longer term plan is to find some way to recycle, especially fiberglass, which is the biggest problem. There is a Duquesne University professor who occasionally sits in on our board, and they have some interest in trying to develop a program around recycling the fiberglass. That's where we'd love to go, but we're not there yet.
Great. And then just a rhetorical comment or question. It would be nice if the board could hear in the future about a return on investment. So how can we quantify the environmental impact, the potential health impacts, et cetera? So it might be nice if we approve use of environmental funds that we hear about the impact they have.
Yeah, no problem. The good thing is Allegheny Cleanways and Three Rivers Waterkeeper is intimately involved in this, and we can track through them and also through the receipts from the marine salvors who would do the work.
Would you want to add that to the request in a formal way to have that reporting?
I would. I'd be in favor of that.
Okay. All right, well, then can we get, is there further discussion?
Well, Dr. Portlock, if I'm gonna propose adding something, I would propose that we hear back, what happened to the abandoned boats. In other words, did we do the best that we could with the waste? So in here, did we explore all options for recycling and avoiding another waste stream? And number two, can we quantify any benefits that came out of it?
Okay.
May not be possible to do the best with either of those, but I want to know that we're trying.
Something.
Yeah.
And we usually do in our agreements add a reporting aspect of that, so we can surely add that in.
Okay.
Actually, my question was around funding and the fact that your goal is $250,000, which seems like a drop in the bucket compared to what you told us has been going on with these folks. And we have lots of partners that you talked about a little bit. Is River Life part of that? Yeah.
River Life is actually on our board.
Is on your board, okay.
Yeah.
I'm just thinking, we maybe start, but I think that the goal is a little low. And this is a problem that's been going on for a long time. Looks like it should be more of an investment fund, long term, just a suggestion. If you have some of the big players already, I think $250,000 is not gonna make it sustainable. And so, just kind of thought.
No question. This is just a place to start.
Okay. Any additional comments for discussion or questions? All right, so, can I have a motion and include that includes the amendment discussed?
So moved.
Can we be specific? So a motion for to approve this environmental health fund request with an amendment to include reporting about what happens to the boats and what the channels for the disposal or reuse of the waste is.
Yeah, what happens to the boats and best estimate about the positive environmental and health impacts of removal of that particular boat or boats.
Okay, all right, so that's a motion. Can I have a second? No, Dr. Snyder made the motion for the minutes purposes.
Okay, I second.
Okay, Dr. Salmon seconds. All in favor? Aye. Any opposed? Any abstentions? Okay, the motion passes.
Thank you.
Thank you.
Thank you.
Next, we have Mr. Ian Anderson here with a Clean Air Fund modification request.
Okay, so I am coming up to present a change to a Clean Air Fund grant that we've already awarded to the Borough of Swissvale. So in 2023, a Clean Air Fund grant was awarded to Swissvale to replace 2 diesel garbage trucks with 2 electric models. Unfortunately, and this might have been kind of a change in the ability of the vehicle manufacturers, but they are not able to acquire 2 small truck bodies and put garbage, I don't know what they're called, the chassis part of it together. So they're asking us to modify the grant to remove the requirement for 2 trucks and change it to 1 large truck. So they'd be replacing 1 diesel truck with 1 large electric truck and the charging infrastructure. They aren't asking for a change in like the total value of the grant. They would just be, using it towards 1 instead of 2, which is about $700,000.
Questions? Dr. Mendez?
With the replacement of 1 truck, is that equivalent to the 2 smaller trucks? In terms of volume?
I don't think so, because it'll be equivalent to the diesel truck that they're replacing. So it'll be the same size capacity for garbage collection that the one they're replacing. But it's going to be a smaller amount than the previous grant.
And the estimated pricing for that is the same?
It's about the same. Yeah, I think the charging part is about $50,000, and then I think $650,000 for the truck. It's about that.
So just to further clarify, the original grant was to replace 2 diesel trucks, and now we're replacing 1 diesel truck.
Yeah.
Okay.
So they would maintain 1.
So there would be 1 electric and 1 diesel instead of 2 electric, and so that means that the amount that can be hauled is going to be less than
what they had originally thought. I believe so.
okay. How much less, do we know?
That I don't know, but
I'm actually a Swissvalian, as it turns out, so it's particularly interesting.
so I guess in this sense that they'll be maintaining the capacity they have now with the trucks they have, because they're going to replace the diesel one with an equivalent size one. I think they were hoping to have 2 smaller ones, just, more crews they can send out. I think that was kind of the idea, but I think they'll just have to maintain the way they've been operating the waste system.
Do you have any information about the impact on emissions or anything like that that would be coming along with this?
Yeah, so I mean, it will be less. So since they're maintaining 1 diesel truck and just scrapping 1, so I mean, essentially what would have been saved, it will be, sorry, this is hard to say. So yeah, 2 trucks, they were gonna remove 2 trucks. That would have reduced, a certain amount of CO2 and PM 2.5 and NOx emissions and things like that. Since they're gonna maintain 1, it'll essentially be half of that. So there will be some difference in the amount of pollution that will be, the air pollution reduction that will be maintained here, because they won't be getting rid of 2 trucks. So, yeah.
Okay, any other questions?
Was the original plan to get rid of 2 trucks and replace 2 trucks?
Yes.
So now the plan is to get rid of 1 truck and replace with 1 truck?
Yes,
And there's still 1 diesel truck?
yes.
And the capacity of the one that's being replaced is not the same as the 2 electric models that would have been purchased?
I believe so, yes.
Okay, Dr. Mendez?
So just to clarify, sorry.
Oh, yeah.
The 1 replacement, I'm assuming is much larger capacity than the original 2 smaller trucks?
Yes.
Okay, all right, just wanted to clarify that. So capacity is the same, but the diesel emission is not reduced at the same amount as the original proposal.
Yes.
But didn't you just say that the capacity was reduced as well?
Well, I guess,
Hauling capacity?
like in the context of them replacing 2 trucks with 2 small. Oh, wait, okay, now I see what you're saying. So there's getting rid of 2 larger trucks to 2 smaller trucks. Yeah, okay, I see what you're saying here, yeah. So I guess part of the problem was is that when we awarded the grant and issued this, is that Swissvale hadn't specified in their grant application, like, the capacity of these 2 smaller electric trucks. Because they were gonna go out and find a supplier and a chassis builder who would, you know, would make these. So I think it was kind of up in the air about what the capacity of these 2 smaller trucks was going to be. And it just turned out that there was just no way for them to get these fitted and created. So they had to go with essentially what the city of Pittsburgh is doing with our targeted airshed fund grants of they're going with these fairly large sized trucks that you would see, you know, what the city of Pittsburgh does for garbage or recycling collection, which is comparable to what the diesel trucks are now. I don't quite know what their idea was with using getting 2 smaller electric trucks. Maybe it was just, you know, navigating the streets of Swissvale, maybe it would be a little easier down the alleys, things like that. But, you know, it was what their application was for. I don't know if that clarifies anything.
Will they be able to navigate the streets of Swissvale with the larger truck that they have, that they're trying to purchase?
Yeah, I talked to the borough manager, so the capacity, like the garbage capacity of this truck is the same as the diesel one, but it's actually shorter. I guess it's a different style of truck where, you know, the cab is over the engine. So you kind of have the flat front. I don't know if you've seen the city of Pittsburgh trucks. They have these kind of flat fronts and the engine's mounted right behind the cab or under the cab. And I think what Swissvale has is like the more traditional, like if you saw like a large delivery truck or something like that, that has the engine in the front of the cab. So you're sitting here and the engine's in front. So they're going with this different design that will be shorter than the diesel it's replacing.
Was it Swissvale that had the recent problem with navigating the streets with their garbage trucks?
No, that would have been, that was the street sweeper.
Ah.
Was it the electric street sweeper?
I thought that was Nash.
Yeah.
Thank you.
I also know, because I live in Swissvale, that they are piloting an every other week schedule for recycling pickup right now, as opposed to an every week schedule, which it had been on. Does that impact the usage of the truck, the diesel versus the electric truck?
I don't know with that. He didn't say anything about that. I don't know.
Garbage versus recycling?
But I think that this is just for recycling, because right now there's a garbage truck and a recycling truck. Different trucks. They're different trucks.
This is a garbage truck, yeah.
Which truck is getting replaced with garbage?
I think there's 2 recycling trucks currently. There's garbage trucks and then there's 2 recycling trucks.
Yeah.
This is gonna replace one of the recycling trucks.
And what's happening with the truck they're getting rid of?
And it'll be scrapped. We put in conditions in their contract to, so it can't be resold. It'll have to be sent to a scrapper, a hole drilled through the engine. They send us pictures and it'll just be recycled.
What is the timeline that they are on for this? Is there an urgency to it? I'm just wondering because I'm feeling like there's some information missing.
Yeah, their grant goes through, I want to say 2028 with a 1-year extension. We could offer them a 1-year extension. So I think it could go through 29. So there is some time. Lead time for these have been, for like some of these other projects we funded, have been like 18 months to 2 years from ordering to like receiving the truck. So it's a pretty extended timeline, but you know, this grant's been going on for several years, so.
Okay, further, we have continued discussion with that.
So they just, to be clear, so they wanted the 2 smaller trucks, they couldn't source them, so now they just want one because that's all the $700,000 will cover is one larger truck. Is there gonna be any left over or is, in the funds, or is that fully?
There'll be some amount of that will be used for the charger, like to
Okay.
charge the truck. And any amount that's unused, this grant didn't have any like administration cost. So if they any funds that aren't used for the truck or the charger will just go back into the clean air fund.
Dr. Yonis?
Yeah, that was just sort of my, in order, I think, to approve or is to ensure that difference in budget versus proposed and actual and now is reported and clear.
Yeah.
Sorry, another question.
Yeah.
At this point, do they have an estimate?
Uh,
Because the original proposal expected, something to be sourced that could not be, so at this point, has that full discussion happened, and is there an estimate that they'd be able to determine we're sort of green light to move forward?
Yeah, he didn't send me the quote, but the quote from their suppliers was, pretty in line with some of the other electric garbage trucks and recycling trucks we've purchased through other grants, about 650,000, so we said. But we, just like the way we structure these clean air funds grants, we usually don't try and prescribe how they purchase them. So we're usually not asking for their invoices or purchase orders, so I might have some.
I feel like the question isn't so much about, being prescriptive about what model that they have to get, more about that we are, basically paying the same amount for half the emissions reduction.
Yeah.
Which I feel like having some more information about the impact of this change on the things that we're trying to measure would be really helpful. I'm not sure if I'm seeing some nodding, I'm seeing some nodding across the table, which means that I think the right move here might be to ask for a motion to table this, until we have a bit more information, until our next meeting perhaps. September's gonna be a big meeting, but I guess, I will ask for that motion, and we can see if there's any other discussion that we go on.
I move that we, table this vote till the next meeting, where we get more information.
I second that.
And invite the public, the admissions will be based on the cost.
And what the cost is gonna be, yeah, and the capacity, the whole capacity, because we need to have that question too. Okay, so I heard a motion from Dr. Pettigrew, a second from Dr. Cuevas. Any further discussion? All in favor? Aye. Any opposed? Any abstentions? Okay, made a motion to table the discussion, bring us back more info, we'll look at it again. Thank you. Okay, Mr. Jason Moranchi is up for two modifications to Article 21.
Thank you. I'm Jason Moranchi of the Air Quality Planning Program for the Health Department. We have two regulations that we're bringing to you today with a request to move to public comment with these regulation revisions to our Article 21 rules. These are both also SIP, or State Implementation Plan revisions. The definition of a state implementation plan, it's our larger group of almost, if you can look at it as an encyclopedia, a set of rules, plans, regulations that we have in place.
I'm sorry, is your microphone on?
Oh, can you hear me now?
Yes.
My voice is so loud to be dead. I'm usually told to turn the microphone off. Sorry about that. Our SIP in general is like I said, a full, almost like a set of encyclopedia volumes that we use to prove to the EPA under our regulatory authority that we're meeting all of the requirements for the control of the criteria pollutants. These are the 6 basic pollutants that with the Clean Air Act are regulated, and each state and local agency, according to their jurisdiction, are deemed to be in control of. So this larger set of regulations is for the entire state of Pennsylvania, and what we're responsible for is the Allegheny County portion of the state of Pennsylvania's SIP for specific regulations. And we've maintained this Article 21 as a separate set of regulations from DEP's regulations, essentially because we were here before they were around. So that's how we've been sort of grandfathered in, along with the County of Philadelphia when the EPA started to designate the responsible authorities for areas throughout the country. Moving on to the revisions themselves. So we generally refer to these as either just a revision number or a SIP revision or just SIP 107, just as shorthand. I promise I won't use too many acronyms today, but the first revision, revision 107, is a pretty straightforward, you can go ahead, nice. Pretty straightforward revision that was first started when we decided to change our name to, I believe Dr. Van announced it last November even maybe at this point, when we decided to announce our name change from the Bureau of Environmental Health to the Bureau of Environmental Protection, specific to air quality and water. There is still a Bureau of Environmental Health, but it's different programs now that are falling under that, not just air quality and water quality. But when we started looking at some of Article 21, there were a number of other nomenclature revisions is what we're referring to this revision as. When we started to look at mentions of the commissioner, which we don't have anymore since we have a county executive's office. Just the use of his or her. Sometimes it was still his in regard to pronouns to certain functions in Article 21. So there were a number of, maybe even furthermore, the disclosure statements is an interesting one. We were required to make disclosure statements so that there were no conflicts of interest for certain members of our air quality staff. Since that time, back in the early 90s, that we were required to do that under the Clean Air Act, we now require under the state rules that every civil employee is required to do that same disclosure statement. So it's things like that that we just went back and started combing through all of our 300 plus pages of Article 21 to make sure that everything is updated for the proper street addresses even, the naming and the proper authorities that are there, and it is and maybe even one more that's specific to today. Instead of an air quality action day, DEP is now revising that to an air quality alert day. That does get a little bit confusing because there are code red days, there are Allegheny alerts, but in this case, we felt that the nomenclature for air quality types of days are more perhaps proactive in the sense that we're alerting the public to potentially high ozone PM 2.5 readings, and we're not necessarily asking for action, even though we do encourage you don't use vehicles, you don't pollute, you don't do whatever it might be, you don't leave your boat in a river. That was very interesting, by the way. But so we're thinking this is a better nomenclature, and it's also in alignment with DEP as well as other states that moved to more of an air quality alert instead of an air quality action day. So overall, this revision 107 is purely administrative, but it does correct several things that we had just not gotten a chance to look back over the past 20 years, maybe an update Article 21 in general for. And again, this would be, we're requesting to go to public comment in the same manner that we're requesting with SIP revision 98A. We want to move to the next slide. Now, first off, I will apologize here. Sean, you can go ahead and move to step up. I'm sorry, thank you. I'll apologize that we sent, I believe, somewhere a total of 400, 500 pages related to this revision to our Article 21. This is a little bit more difficult to explain, but we have presented changes like this in the past that related to the overall purpose of these. And these relate specifically to, for the control of ozone, the control technique guidelines that EPA publishes to control volatile organic compounds, or VOCs. And even again today here, this is very pertinent that the more VOCs we can control on very hot, very sunny days like today, it's less of a precursor that would lead to ozone as well as PM 2.5 creation. So these 200 plus pages that we sent involve a series of regulations that involve surface coatings mainly, and the controls that we have in place for those surface coatings. I can't even find the full list of surface coatings, there they are. From things like asphalt paving, graphic art systems, wood paneling, industrial solvent cleaning, just many things that are on the list. Some of these we don't even have in the county, like the extra large dry cleaning manufacturers that was in a previous SIP revision that we performed. However, according to EPA requirements, we are required to adopt everything that is published as a control technique, and then furthermore, we're required to, with each set of the ozone regulations, the ozone standards that EPA promulgates, we're also required to review those along with the state as part of the overall state implementation plan to verify that these are still technically accurate and somewhat up to date, although EPA themselves haven't updated these maybe in a decade or two. But our overall purpose was to certify that our regulations are as stringent or equal to PADEP's regulations in place, if not more specific in nature. And I'll give acknowledgement here to Tom Latner of our staff, who has, again, working through 300 plus pages, comparing DEP's regulations to our regulations, attending regular meetings with both EPA and DEP and Philadelphia Air Management Services to make sure that all of our regulations are up to date and consistent. Now, as we were revising or going through the comparisons of all these documents to make this due diligence comparison in line with the state of Pennsylvania, we determined that the easiest way for us to do this, it also shrinks down Article 21 by several pages, to simply incorporate by reference the state's regulations that they've performed their analysis on. That way we can reference their regulations, and in a handful of places where it is more stringent. An example might be storage tanks. There's a rule for the surface coatings from storage tanks. DEP's regulation is for storage tanks 4,000 gallons and larger. Our regulation is for storage tanks 250 gallons and larger. So it's just a little bit more specific, a little bit more stringent than the state regulations, and again, we've combed through that and made these analyses. Most of them are included in the Appendix A in great detail, comparing the two regulations side by side. But overall, this is, we'll be going to public comment with this, and it should be the certification that's needed to EPA, showing that we've done our due diligence review as part of the state of PA for the control of ozone and the specific control technique guidelines. There's a lot of information. I hope that makes sense to summarize 500 pages in just a few minutes. Any questions on either the easy one, the nomenclature 107, or the very difficult 198A, which really just boils down to, again, simplifying our regulations, but it's a lot of complex material involving equations and VOC content and things of that nature for surface coatings.
Thank you for both the technical expertise and the diligence it takes to do that combing and for this presentation. And as a reminder, these are both things that we would be voting out to a public comment period for 30 days. Are there questions, discussion from the board about either the nomenclature 107 revisions or the volatile organic compounds? Okay, all right, well, we're gonna do two votes on these. So the first will be for revision 107 on nomenclature. Can I have a motion to approve?
Motion to approve.
Can I have a second?
Second.
All in favor?
Aye.
Any opposed? Any abstentions? Okay, motion passes. That one is sent out to public comment. The next for revision 98A, the update on the VOCs and RACT technology, reasonable available control technology. And both of these are just to bring our standards into compliance, basically. Our regulations match where they need to match and are more stringent when they need to be more stringent. Can I have a motion to approve?
Motion to approve.
Thank you. Can I have a second? Okay. All in favor? Aye. Any opposed? Any abstentions? Okay. 98A is passed. Thank you very much.
Thank you very much. See you in a few months.
Yes. Okay. We just have one thing left.